This really builds on prior webinar series our Institute has offered, and really today and in the future is really just trying our best to introduce you to many familiar faces, but also some new faces to NIFA, including today our special guest, our new director, Dr. Castille. My name is Sheila Fleischer. I'm one of the new faces at NIFA, and I'm in a new role here at NIFA, which is a National Science Liaison for Nutrition and Food Safety. I have the honor to work with Dr. Helen Chipman, who you'll hear from today, co-leading a growing nutrition security team. And as you can see, part of our team approach is really building across the diverse agricultural sciences NIFA brings to the table to address these issues of food and nutrition security. This really is an administration priority that we're proud to embrace. We've worked on setting the tone for what that means to us at NIFA and how we might build a framework across our diverse programs to really help prioritize this new idea of nutrition security. I wanted to start with defining it. I had the honor of working with Dr. Muzaffarian and Chef Jose Andres on working on a commentary on what is nutrition security. It's not a new concept, but we really are trying to elevate its role, particularly during the COVID pandemic when we saw such skyrocketing rates of nutrition and food insecurity. So nutrition security is having consistent access, availability, and affordability of foods and beverages that promote well-being and prevent and, if needed, treat disease, particularly among our nation's most socially disadvantaged populations. And so here I just want to emphasize food security is something we're still working towards and still monitoring, but we really want to elevate the difference between nutrition security and food security, is that we're not just maintaining a healthy and active lifestyle. Nutrition security recognizes that the majority of Americans are not healthy and are battling one, if not more, diet-related chronic diseases. We want to also recognize as we launch this series that food insecurity is something that our nation's been battling pre-pandemic, but obviously during COVID, we saw skyrocketing rates. Because of the variety of federal nutrition assistance relief programs in effect right now, we are seeing declines in these skyrocketing rates, which is promising, but disparities exist. So a lot of our effort here at prioritizing nutrition security really takes that into effect, that these disparities affect Black, Latinx, Native American more disproportionately, our rural communities more disproportionately, and other socially disadvantaged communities. So as noted, and as you'll hear today and throughout this series, we've been really working across 20 different programs at NIFA that are connected to nutrition security. Some might be more surprising or interesting than others for folks that are not necessarily traditional programs. And that I think is going to be the fun part of this series, is seeing how various programs in our local economies, our beginning farmers, and our more traditional programs are really embracing this concept of nutrition security. And for many, they've been doing it for years. So it's really exciting to lift up their work. Some of these emerging team priorities are things that many of us in the nutrition field are working on. This includes supporting innovative, inter and transdisciplinary solutions, really harnessing a holistic research agenda from farm to fork, integrating climate smart agriculture. We'll definitely have some series that dive deeper with our climate team on this area. And really throughout all this, empowering individual and community agency, particularly among our most socially disadvantaged communities. So today I have the honor of kicking off this series. And as you can see from our panelist list, it's a great group of scientists and includes our new director, Dr. Carrie Castille. She's going to give us an overview of how NIFA's attacking this issue. And really, again, our goal for kicking off this series is to get to know all of the people behind these programs a little bit better. So I'm going to transition now to you seeing Dr. Castille live and getting to know her better.
Thank you so much, and thanks, Sheila, for your introduction and your leadership on NIFA's Nutrition Security Team. This new team is an incredible group of people who are working hard to make a difference in people's lives. So I'm Carrie Castille. I'm the director of the National Institute of Food and Agriculture. Born and raised in a little community called Brobridge, Louisiana, about 9,000 folks. So I'm actually in Louisiana right now, Lafayette. We moved to Lafayette, but really have a great appreciation being from rural Louisiana, knowing firsthand the food insecurity needs that we've seen in Louisiana, and knowing the impact that you could have. And these educational series are just, I think, a great opportunity to be able to showcase what we're doing at NIFA and emphasize our partnerships. Working in cooperative extension and USDA rural development also gave me an opportunity to learn more about the root causes of the national issues. In an area famous for food, the Mississippi Delta is also known as an area where people often suffer the health impacts of unhealthy diets through no fault of their own. Food is a part of our culture, our tradition, and our social life. In one of the richest agriculture regions in the nation, it's also an area where access to nutritious food is not always easy. People eat what they have and prepare it the way that they've been taught. So I have a very personal interest in the work of NIFA's team. We've built a diverse and talented team to leverage NIFA's assets to help our country prosper. We must use our combined expertise and resources to address the unprecedented rates of food insecurity among our fellow Americans. I'm so impressed with our agency's ability to quickly mobilize expertise in nutrition security, in climate, economic recovery, and racial equity, amongst others. But it's not just the expertise that NIFA staff bring to the table. It's their passion to really, really make a difference. Earlier this month at one of our NIFA all hands meetings, I heard from members of our staff as they voiced their thoughts on hunger in America. They shared a variety of ways NIFA does and can help prioritize nutrition security in America. At NIFA, we believe promoting nutrition security is a critical ingredient to recovering from the COVID-19 pandemic, to rebuilding the rural economy, to addressing the impacts of climate change, and ensuring racial justice and equity. From our expanded food and nutrition education program, FNEP, that you will hear about next, to our farm food safety training, the strong focus that USDA is putting on addressing the hunger and food security crisis in our country is our chance at NIFA to shine together. Without question, much of our work in nutrition truly depends on our external stakeholders' expertise and insights. NIFA has also used a variety of formats, such as NIFA Listens and the Calls to Conversation meeting series to share agency overviews and gather input from our stakeholders. We designed this monthly NIFA Nutrition Security series as one approach for our external stakeholders to hear more from us on this important priority area. We'll also use this series to highlight our partners' efforts in nutrition security as well. From our initial assessments, NIFA has great potential to accelerate our department's efforts to prioritize nutrition security. For fiscal year 2021, our agency is estimated to invest more than $122 million to promote nutrition security through the following 5 primary priority programs that you will hear about today. First, our expanded food and nutrition education program, or FNEP. Second, our Gus Schumacher Nutrition Incentive Program, or GUSNIP. Our community food projects, our food and agricultural service learning program, and Agriculture and Food Research Initiative, AFRI, competitive grants program in diet, nutrition, and the prevention of chronic diseases. NIFA supports 17 additional programs that also promote nutrition security, and future webinars will dive deeper into each of these efforts. A key ingredient to our nutrition security activities is developing and leveraging a diverse, interdisciplinary workforce through our support of our AAAS Science and Technology Policy Fellowships, our USDA internship programs, our USDA 1890 National Scholars Program, our AFRI Education and Workforce Program, NIFA's Higher Education Multicultural Scholars Program, and the Hispanic Serving Institutions, our HSI Education Grants Program, among others. During meetings with our staff and stakeholders, I've been impressed with our consistent inter and transdisciplinary methods to develop a holistic approach to nutrition security. This work takes into consideration how the COVID-19 pandemic constrained traditional approaches to research, education, and teaching. Research, extension, and teaching, which were compounded by skyrocketing food insecurity and unprecedented food supply chain disruptions. I'm pleased that NIFA is very mindful to foster sustainable business models for innovative approaches to promote healthy food and beverage choices particularly amongst SNAP and WIC authorized retailers. We are examining the potential for every link of the food chain to help build more sustainable, resilient, equitable, and nourishing food systems from first production, which includes agroecology, community and home food gardening, urban agriculture, and farmers markets, to preparation, ensuring sufficient, safe, and nutritious food preparation in culturally, contextually, and economically sensitive ways, including disaster preparedness, to consumption, enabling positive and sustained healthy eating behaviors to decrease the health and financial burden of diet-related non-communicable diseases and health disparities, to increasing access to and improving the nutritional quality of our federal nutrition safety net, and also disposal, limiting food waste while ensuring food safety. NIFA is truly leveraging all of our assets to spark transformative discoveries, education, and engagement with the greatest potential to promote nutrition security while also fostering better integration with climate-smart food and agriculture. NIFA continues to believe that a critical component for all of these efforts is people. We build on our outstanding extension legacy to promote nutrition security, particularly among our nation's most socially disadvantaged populations. This includes working with the USDA Office of Tribal Relations to help promote food sovereignty. Thank you for joining us today as we kick off this very important series. I'm very excited about NIFA's current efforts and potential to prioritize nutrition security and look forward to working with each of you in the future. Now we will officially begin this new webinar series. First up is Dr. Helen Chipman and Dr. Corinthia Cherry with FNEP. Thank you so much.
We'll try that again. Thank you, Carrie, and thank you to all. It looks like we have more than 200 people on this webinar today, and we are thrilled to be able to visit with you and talk a little bit about this part of our programs that are so important to so many of us. And we've been asked to share a little bit about ourselves as well as about the programs. I oversee the Expanded Food Nutrition Education Program, among other things, known as FNEP. I'm going to share some of my time with Dr. Corinthia Cherry, who also provides leadership to the program. And I'll be speaking from a domestic context since FNEP is for the 50 states and the US territories. So on a personal level, from my earliest years, my parents have said that I am a champion of the underdog. I am drawn to people who are struggling. And my desire is to help them help them in their efforts to experience success in their lives. And that seems to be part of my DNA. So the Expanded Food Nutrition Education Program, or FNEP, is a really good fit for me. I've been involved with FNEP for most of my professional career and even did some of my graduate work in evaluating this program. I've also worked actively with other organizations and agencies that share in this space, because we need to have a cooperation and synergy through our respective and our combined efforts. Perhaps many of you know that FNEP is the nation's first and longest lasting nutrition education program. It has been part of the fabric of this country for more than 52 years and counting. It is a program that remains nimble and is also continually evolving. And it is a program with results. Later, we're going to do a deeper dive and we'll be able to talk more specifically about more of the details of FNEP. But I think it's important to also recognize the history. FNEP arose out of concerns that were raised in the 1960s when a face was given to what it meant to be hungry and poor. We are addressing those same concerns today, but we are doing so with this broader perspective of trying to improve nutritional insecurity. We have greater understanding and we're trying to approach it in a more comprehensive way, as Carrie just noted. FNEP is at the heart of addressing food insecurity by NIFA and its partners and collaborators as it reaches families, youth, and children with limited financial resources and helps them gain skills to improve the quality and the adequacy of their diets and thus their nutritional health and well-being. Importantly, when we talk about nutrition education, diets, and health, Within FNEP, we are talking about much more than nutrients and nutritional value. We recognize that food is important to people on many levels. So we take into consideration social, emotional, cultural, and other aspects of food and health in what is taught and how that information is shared. FNEP is also about relationships. Peer educators, people who come from those same neighborhoods, who come from those same experiences, are hired to provide this learning and to interact with those that we are trying to reach so that we can teach people in the context of their lives. And we teach to support change because our intent is to help others have greater success in their efforts to improve the nutritional health and well-being of themselves and their families, and even extending into larger groups such as extended families and even communities. Corinthia will speak more about FNEP and nutritional security specifically. I just want to end with a personal goal of mine, and that is that in all that we do not leave some people behind. That in our efforts as a nation and across the globe, we are mindful of those who are experiencing challenges such as poverty and do what we can to help them experience greater success and gain greater confidence in their efforts to provide for themselves and their families and their communities, such that they can be part of the solution for achieving greater success and greater nutrition security in this nation. Corinthia, if I could turn it to you now.
Thank you, Helen. Good afternoon, everyone. Again, my name is Corinthia Cherry, and I serve as the FNEP National Coordinator. And I'm another one of those new faces, having just come on board in December of 2020. So still learning, but glad to be here and glad to be a part of the nutrition security efforts at NIFA. So I'm new to NIFA, but not new to this area of nutrition security and nutrition education. I'm a product of the land grant system. For the past 9 years, I worked as a nutrition specialist at 1890 institution, North Carolina A&T State University. And in that role, I worked to develop nutrition education programs specifically for those who are in limited resource communities or limited resource audiences. So working to develop nutrition education for youth and adult audiences. And as a part of that role, one of the key responsibilities was working with community-based organizations and helping those organizations implement sustainable programs that would help them to improve nutritional health for those living, working, and playing in their communities. So again, not new to this area, but new to NIFA, and glad to be a part of FNEP. Worked with FNEP as a part of the Cooperative Extension Program before. And so now I'm here, and it's an exciting time to be here with this focus and this not renewed, this focus that we've had in the past and that we'll continue to have in the future on what nutrition security and how we can improve the nutritional health of our nation. So here we just have a couple of examples of the programming that we've done. And again, it illustrates to us, as Helen said in her comments as well, FNEP has been around for about over 50 years now. So we've been in this realm. We're not new to nutrition security, and we're going to continue, and we're poised to do great work in this area. So these are just two examples of those programs here. The other moving next to the next slide, we're going to talk a little bit about FNEP. So we have our goal here. What's the priority of FNEP? It's a nutrition education program, and our goal is to reduce nutrition insecurity. And our audience is families, youth, and children with low incomes. So what we want to do is we target behavior change, and that's going to be really important when you think about how we're going to improve nutritional health. The core areas for FNEP include diet quality, physical activity, food resource management, food safety, and again, that food or nutrition security. That's going to be the key. That's what we really want to make sure. As we've noticed, or that was highlighted for us during the pandemic, that nutritional health can have a huge impact on overall health as well. So our FNEP program operates through our cooperative extension system at 76 institutions. It is at all 1862 and all 1890 land grant institutions. in all 50 states. And it also, as Helen said, operates in our 6 territories and the District of Columbia. And we use that peer educator model that helps to build and support trust when individuals can see others in their community and receive that messaging from them. So we're going to talk about a little bit of the reach for FNIP. More than 88,000 adults and 300,000 youth and children participate annually. And so we've been around and we've been able to impact the lives of over 34 million individuals. And one of the strengths, several of the strengths of FNIP that we just want to highlight is that there is proven success. We have the program data that supports program effectiveness and efficiency. And what we've done over the past year or so, thinking about how we've transitioned during the pandemic, looking at how we operate our programs, one of the things that we've tried to do and we've helped our audience to do is to be nimble. We understand that things have changed. We understand that how we did things before, we might have to do them a little bit differently. And so we've worked with our community partners, our university partners to help them see, to talk with them and see what some of the needs that we could meet in a different way. And so this nutrition security program, the nutrition security team that's here today, also all of nutrition programs or nutrition programs associated with NIFA are a great example of how we're poised to move forward in this area and how we can make sure that our nation is nutritionally healthy as well. And with that, I will turn it over to Mallory for GusNIF.
Thank you very much, Corinthia. And thank you all for joining us this afternoon. I'm Mallory Koenigs. I serve as the National Program Leader for the Gus Schumacher Nutrition Incentive Program and for the Diet, Nutrition, and Prevention of Chronic Diseases program area within our athlete portfolio. I have been part of the NIFA family for over 6 years now. I completed my graduate and postdoctoral training on national research initiative and Afri childhood obesity prevention projects, which is really what led me to be aware of the federal career opportunities with NIFA, the path that I've pursued for my career now. So it's wonderful to share, my passion for improving and promoting health and preventing chronic disease with you all, and to be a part of this webinar series as we're kicking off our portfolio and how it relates to nutrition security. So the first program area that I'm going to speak briefly about to you all is the Gus Schumacher Nutrition Incentive Program. And what I want to provide as an overview now is that this program includes 3 distinct grant types. The nutrition incentive grants, which focus specifically on providing fruit and vegetable incentives to consumers participating in the Supplemental Nutrition Assistance Program. And those fruit and vegetable incentives are provided to consumers at the point of purchase, so where they're purchasing fruits and vegetables. Within our nutrition incentive grants, there are pilot projects, standard projects, and large-scale projects. I'll give an example of each. Pilot projects are in the early stages of development and are testing some new and innovative strategies. For example, a curbside mobile grocery truck to improve access and affordability of fresh produce. Our standard projects are established fruit and vegetable incentive programs that are working at a multi-county or maybe a state level. An example of one of our standard projects in the GusNIF portfolio, it's one that supports 45 local farmers in bringing all of their produce to farmers markets where the fruit and vegetable incentives are used to increase the purchase power of SNAP consumers. For large-scale projects, these are generally multi-state or regional, and an example might be one that we have where there are 118 different food outlets participating that include supermarkets, corner stores, farmers markets, as well as mobile markets. The projects focus on the, of course, providing the fruit and vegetable incentive, but also increasing fruit and vegetable consumption, and also capture nutrition education opportunities to really, again, focus on that health promotion, how we can improve the affordability and accessibility of healthy foods in all of our communities, and preserve and sustain health. The next grant type I want to provide an overview for you all are the produce prescription grants. And these projects are exciting. They're early on in their livelihoods. We have about 2 years worth of these right now active in the community, and they focus on increasing fruit and vegetable consumption, improving overall dietary patterns, reducing food insecurity, and decreasing healthcare costs and healthcare utilization. So fruit and vegetable prescription programs that are part of this portfolio that are ongoing throughout the country could serve a number of families. One example, we have a fruit and vegetable project in Navajo Nation that in their first year served 200 families and distributed almost 10,000 fruit and vegetable prescriptions. And this has been a wonderful project. These projects specifically target participants who are at risk of a diet-related health condition or who are managing a diet-related health condition. Next slide, please, Sheila. The third grant type that the Gus Schumacher Nutrition Incentive Program supports are the Cooperative Agreements. And the Cooperative Agreement is specifically for the GusNIP Training, Technical Assistance, Evaluation Information Center. The center supports GusNIP applicants and grantees through that technical assistance piece, and also through that evaluation and information piece. It collects and aggregates national outcome data, whether it's the food outlets, right, firms or sites where these nutrition incentives or produce prescriptions are provided to participants, or participant level data to look at the fruit and vegetable consumption, the dietary patterns, the health outcomes, depending on what the target audience is. And all of these core metrics are collected and aggregated by the center to help get a really nice picture of GusNIP on the national level, identify best practices, and work hand in hand with NIFA and our partners at the Food and Nutrition Service to continually improve this program. What's also wonderful about this partnership through the cooperative agreements is that these data are available for the broader public. These core outcome measures that GusNIP, Nutrition Incentive Grants, and Produce Prescription Grants utilize are also publicly available. So any practitioners who are working in the nutrition incentive or produce prescription field who may also want to take advantage of these data out there, be part of this community utilizing these measures to improve the evidence base of our programs can all really be part of this program. Thank you, Sheila. Next slide, please. I also want to take this opportunity to highlight for you today the Diet, Nutrition, and Prevention of Chronic Diseases program. So this program is part of the broader AFRI, or Agriculture and Food Research Initiative portfolio. It's part of that Foundational and Applied Sciences, RFA, for those of you who are familiar with AFRI. And this program is inviting projects that are integrated. You heard Director Castille talk about our research, education, and extension focus that we have in NIFA, and integrated projects are those that address 2 out of those 3 functions of agriculture in their project design. So those are the types of projects that are invited by this program. This program supports not only standard grants, but new investigator grants, seed grants, which are very much like pilot grants, as well as conference grants. Sheila, if you would go to the next slide, please. You'll see here what the program area priorities are for the Diet, Nutrition, and Prevention of Chronic Diseases program. I'll highlight for you sort of the breadth of the types of projects that have been funded in the past by this program. So these include interventions of trials that are based in school food service, looking at improving student health as well as the environmental health supports, DASH diet and physical activity intervention trials, focusing on the prevention of hypertension in older adults, trials that focus on preventing type 2 diabetes and food insecurity through specific interventions, maternal and childhood obesity prevention trials that look at outcomes starting in the 3rd trimester of gestation through preschool age, as well as urban 4-H after school, advanced cooking education programs. So there is a great variety and a great breadth that is really the kind of science that we invite in the Diet, Nutrition, and Prevention of Chronic Diseases program. And it is now my pleasure to introduce to you my colleague, Dr. Lydia Koenigs, who will be speaking to you all about the Community Food Projects Competitive Grants Program.
Thank you, Mallory. Good afternoon, everybody, and thank you for joining us today. My name is Lydia, and I'm a national program leader. Started with NIFA in March of this year, and my education and research background is in nutrition, specifically focused on the role of dietary bioactive compounds in prevention and management of chronic diseases. And previous to this role in NIFA, I had the opportunity to work in various positions in the broad nutrition field, and most recently with the land-grant universities on research, education, and extension being the last role that I held. I joined NIFA because it gives me an opportunity to work with researchers and people in community, as well as stakeholders, to make a difference in communities. That's always been my passion as it relates to nutrition and nutrition program, and the portfolio of NIFA really avails that opportunity for me. One of the programs I currently support and my passion aligns with is the Community Foods Project Competitive Grant Program. And the competitive grant, this project area is one that is critically important for reducing unprecedented rates of food insecurity among the socially disadvantaged communities. So next slide, please. Thank you, Sheila. So this week, CFP, which is the Community Foods Project, celebrates 25 years of existence. Actually, we got this article by Mark Wine, who is a community food activist and writer and trainer, that has started an article featuring a project by Garden City Harvest in Montana. And Garden City Harvest is one of those organizations that received one of the very first grants through the CFP program. And that program continues in the community in Montana and continues to fight food insecurity. I'd just like to highlight that. And if you're interested, could go to markwine.com and look at the article that celebrates 25 years of community food projects in the country. So CFP as a program, I want to just highlight some of the goals of the program so that you know. It is designed to increase food security in communities by bringing whole food systems together to assess strength, establish linkages, and create sustainable systems that improve self-reliance of communities. And that really actually is one of the things that really speaks to me. And that is a good way to have sustainable food programs. So going through this slide, I'll just highlight some of those things that we look for program applications that are coming through. The goal is that it should be an application that looks at fighting food insecurity through developing or implementing community food projects that will help food sufficiency. And it's for low-income communities or disadvantaged communities, socially disadvantaged communities. Increase food security in communities by bringing the whole food system together and creating food systems that improve self-reliance. The program also looks to meet food needs of individuals living under the federal poverty line through food distribution, outreach to increase participation in federally assisted nutrition programs, or improve access to food. It also looks at creating community-led or local or neighborhood food and agricultural programs. And an application can include equipment as would be necessary to make the program efficient and operational. This year, we had, this year, the program received over 200 applications compared to 124 last year. And we think this is a result of the pandemic. So these grants require 100% match, and they should not exceed $400,000 for 48 months. And there is also a component of a planning grant, which should not exceed $35,000 and can be approved up to 36 months. Next up is Lisa, and she will talk about our next program. Thank you.
Thank you, Lydia. I'd like to say good afternoon, everyone, again, and thank you for the opportunity to talk about another of our exciting programs here at NIFA that focuses on nutrition security. I'm Lisa Jans, a new NPL in the Division of Nutrition. Well, I still feel new. My background is in epidemiology and human trials, mostly focusing around characterizing and increasing vegetable and fruit consumption. Am I not on cam? Okay. And I'm going to talk a little today about our Food and Agriculture Service Learning Program, which is part of my portfolio here at NIFA. But first, I'd like to tell you a little bit about why our focus on nutrition security is so personally salient to me, and a reason why I'm so excited about these programs that we have. You see, I spent some time homeless, living off the street or in residential hotels, and I ate at the local soup kitchen. Now, once a month, they would give out 5-pound blocks of cheese. Now, I have nothing against cheese, but I had no way to store it after making a couple of sandwiches, so it really did not address my food security issues, highlighting to me the importance of not just food availability to people, but also the means with which to prepare it as an aspect of nutrition security. The end of my story is that I found a local sandwich maker who had purchased the cheese from me. So we did make good use of that donation and put it back into the local economy. And although I know that many other recipients had to throw theirs out, and I believe that these experiences helped to shape my passion for nutrition security for all in the US. First slide, Sheila. Thank Thank you. So again, the Food and Agriculture Service Learning Program, the goal of this program is to increase the knowledge of agricultural science and improve the nutritional health of children K through 12. There's two aims under this goal. One is to improve leadership and knowledge among children about agricultural sciences, and the other is to improve the nutritional health of children by either improving school meals and lunches or improving access to school meals and lunches. Next slide, please. So all projects must involve underserved rural and/or urban communities and facilitate a connection between elementary schools and secondary schools with agricultural producers in the local and regional area. So many times we see projects where the older secondary students will learn some leadership skills, learn about nutrition and agriculture, and then be mentoring the younger kids as well. There's some pretty exciting programs out there. Next slide, please. So by increasing the capacity for food, garden, and nutrition education within host organizations or entities, such as school cafeterias and classrooms, while fostering higher levels of community engagement between farms and school systems by bringing together stakeholders from distinct parts of the food system. Next slide, please. This RFA is intended for eligible applicants to scale up or further develop existing farm-to-school initiatives and other food and agricultural experiential learning initiatives within a distinct area of communities and schools in a state or region. So these are community-based. There are lots of best practices used, but in a lot of cases, you have to go to your community and find out what their needs are first. This is why these are smaller programs. The applicant should also add to the existing activities or include new activities such as training and technical assistance, evaluation activities, curriculum development, or incorporating farm-to-school strategies in trainings and professional opportunities while working closely with agricultural producers. So what we see is a lot of our grantees have had to pivot with their training and technical assistance programs from face-to-face to being web-based. And this is, the COVID pandemic has affected most of our grantees in this way. So we're really proud that they've been able to adjust to these strange circumstances. Next slide, please. Okay, so some examples of our grantees are expanding farm-to-school programs beyond lunch to bring local products into school breakfast program. Again, providing technical support with webinars, developing promotional campaigns in support of farm-to-school initiatives, establishing new or strengthening existing community partnerships. So working with different personnel at schools and in agriculture to identify appropriate suppliers, encouraging increased consumption of fruits and vegetables through promotional activities, taste tests, and other activities with kids, and expanding their experiential or agriculture-based learning opportunities, such as creating school gardens, farm to agriculture and food clubs, or increasing exposure to on-farm activities. So we see a lot of people who are creating this blend of bringing the kids to the farmers, but also the farmers to the kids. And also developing and evaluating integrated curriculum to reinforce food and nutrition-based learning throughout the school environment. Next slide, please. Now, the Food and Agriculture Service Learning Programs, each award is about $225,000. There are no matching funds required in this case. Last year, we had 53 applications and made 5 awards. Our funding rate was about 9%, but that's because our budget was only appropriated at $900,000. Here in FY 2021, our budget is $1.9 million. So we'll be able to fund a good deal more projects. And our applications rate for this year was 58. And now I'll turn it over to Giselle.
Thank you so much, Dr. Johns. Hello, everyone. My name is Giselle Caceres. I'm the Public Affairs Intern in NIFA's Office of Communications. So as we wrap up today, I just want to highlight a few takeaways that you can share when asked by neighbors, colleagues, or your kid about hunger in America. So you could share that far too many Americans face food insecurity, particularly socially disadvantaged populations, and that promoting nutrition security is a critical ingredient to building back better. And last but not least, that you are a part of prioritizing nutrition security. So with the remaining time, we welcome questions and thoughts about NIFA's current efforts to prioritize nutrition security. So now we'll dive into some Q&A. And so far we've had some really great questions. So I'll invite our panelists to chime in and share their insights. Okay, so I'll go ahead and read some of the questions we have here. So the first one, so we've talked a lot about GusNIF. So who exactly was or is Gus Shoemaker? And Sheila, do you want to take the lead on that one?
I'll let Mallory do that one as the program lead.
Sure. So Gus Schumacher is no longer with us. He was a leader in the nutrition incentive field, worked very closely with practitioners and established the pilot program that preceded GusNIF, the Food Insecurity Nutrition Incentive Program. So when that program, after being successful, was reauthorized, it was renamed in his honor after his passing.
We got many attendees texting me and chatting that they were happy for that shout out. So he's missed and love to see his legacy moving forward. Giselle, you want to ask the next question?
Sure, thank you, Mallory. All right, so the next question, does the PRODIS prescription grant have to be for a multi-state or regional partner, or could a food bank covering multiple counties apply?
That's a great question. So the produce prescription grant type within GusNIF does accept pilot projects as well as standard projects. So anyone working at that smaller scale, just establishing a produce prescription program within a county, or building up to that multi-county level is absolutely welcome to apply to the produce prescription grants.
Okay, thank you, Mallory. All right, so the next question. All right, so I'm a healthy food access food policy evaluator, and I'm wondering what is the best way for me to be in the loop when evaluating RFPs? I'm sorry, when evaluation RFPs are issued.
Yes, I'll take this one too. This is a great question. The best way to always be in the loop is to go to grants.gov and register there for notifications that come from any federal agency, right, that are focusing on evaluation, that are focusing on nutrition. Right? What you can enter whatever keywords you like. You could specifically look for the National Institute of Food and Agriculture programs that have been mentioned today. But my number one recommendation would be to set up exactly the search you want, exactly the alerts that you want to get as soon as something hits the presses in grants.gov.
Great, that's a great tip. Thank you so much. And we have been seeing a lot of questions about the recording. So a full recording will be posted to NIFA's YouTube channel as well as NIFA's website. So if you don't know the website, it's nifa.usda.gov. Okay, and I'll go back to the chat box. All right, so the next question.
Giselle's being humble and not fully introducing herself, but we've been really lucky to have, with our support from Faith Peppers, the Director of Office of Communication, Giselle spending most of her spring and summer with us as a summer intern and really having nutrition background, helping our nutrition security across a variety of things. So there'll be new websites in the work, a variety of social media. Some of it will be clipped of this video or similar recordings of our staff, in particular our new director. So we're greatly appreciative of her this summer. And so hopefully this launch, we're working through Zoom technology stuff as we get started here at NIFA, but hopefully you'll see a variety of stuff from us on nutrition security in the weeks to come.
Thank you so much, Sheila. And I did see earlier you posted an answer to a question posed by a student in Masters of Public Health program. So I'm definitely going to recommend that person to reach out to Sheila. She's a really great resource just for furthering your career.
Well, and our whole nutrition team. So as you see today, really spotlighted all of our nutrition program leaders and our FNIP coordinator and Dr. Cherry. A part of what we do at NIFA is help build the next generation of nutrition scientists and really all scientists and practitioners who are engaging in agricultural sciences. So please feel free to reach out to me. I will connect you with a variety of educational supports that NIFA supports and broadly the federal government supports, including what I highlighted was the Healthy Eating Research, which is a national program of the Robert Wood Johnson Foundation, and also the CDC supported Nutrition, Obesity and Policy Research Network, No Grins student series. This is a series I helped create last year. This year it's a 9-week series throughout the summer. And I think a great opportunity for those who are in early stages of their career to get a sense of public health nutrition vocational opportunities. So feel free to email me and I'll make sure you get the registration link, but really do put that in as a plug for early stage career folks.
Yes, highly recommended. Okay, so for the next question, for the Diet, Nutrition, and Prevention of Chronic Disease program area, is there a directory of projects and or results of the projects publicly available? And are there any ways in which it coordinates with the CDC, HRSA, or NIH nutrition or dietary research? So perhaps each has a complementary niche, or do they share intelligence, databases, or research results? And I'll open the floor for any of our panelists.
So this is Mallory. I'll go ahead and share that, yes, there absolutely is a publicly available database of funded projects. What that is called is the Current Research Information System. You might hear NIFA staff call it CRIS for short. It's linked on our website. That provides information on all of the projects that NIFA has funded, as well as the annual progress reports on their outcomes, publications, accomplishments, and impacts.
Okay, anybody else want to add to that? Okay, all right, and then the next question, let's see. So is there a list available of the upcoming presentations in this monthly series? So this is the first installment of the series.
Yes, part of our goal with launching this series was to model the NIFA Institute for Food Safety and Nutrition, which Mallory and many of our NIFA staff work really intimately on. So we want to use that model of a monthly series. So we'll likely have a second series late July. We wanted to figure out if this time or another modification of a late afternoon time works for kind of national time sensitivity. So we're looking at late July for our second series. We have mapped out about 10 different webinars for this coming year. And so based on popular demand, if that works, we'll continue with that. But it will be deep dives initially with our programs, just getting to know our program staffs in our program and how they're relevant to nutrition security. And then also thinking through, these more deeper dive and pressing issues like climate change and nutrition, how best we can learn from thought leaders and other federal agencies about how best to tackle these issues. So do be looking forward to more save the dates, and we hope to continue to keep all the recordings so you can see them archived as well.
Okay, and we'll keep going through questions. So the next one, so I think this is something that a lot of people encounter. So applying for these federal grants took so much time, energy, and confusion. And this comes from a multi-agency and organization team whose members all had graduate degrees in various fields. So what is being done to make applications more equitable for organizations of all sizes and backgrounds?
This is a big thing we've heard just even launching the nutrition security team when we thought through kind of budget asks that we could ask for FY 2022 and first 2021 and now 2022. Is this idea of how do we make our programs more approachable? So we have a variety of efforts across NIFA that are working on how-to videos, both to how to apply to grants and also how to administer grants. We're also thinking through, and Mallory, I hope will expand next on kind of thinking through match requirements and ways that we could potentially make these programs more approachable to folks. Some of these things we could do, some of these things are outside of NIFA's control and would be a congressional change, but they are definitely areas that we're thinking through in terms of making our programs more accessible, particularly with that diversity, equity, and inclusion lens.
If I could speak up as well, I think several things are going on here. One is absolutely we're looking at how can we better communicate within our RFAs. So part of it is, that the plain language, the simpler, the cleaner. We're taking a very hard look at our RFAs to make sure that anybody who wants to apply is going to make sense to them as, are they eligible? What are the requirements? What is the scope? Some of those things. Additionally, I would not be discouraged if you don't find that you get funded right away. These are incredibly competitive grants based on the amount of funding that we receive. And as Sheila said a moment ago, we're lifting up, and throughout the country, we're seeing the importance of this work. But as well, if it's a tough one to necessarily get an award always in the first round. And so just not be discouraged, keep trying, work with us. There's efforts to improve. One thing I run into, I oversee several competitive awards, and I find that there's differences among potential grantees in terms of their understanding of how to even write a grant and certain types of grants. And so we're working on that end as well, that kind of technical assistance.
I'll follow up what Helen said and reiterate that if it happens to be the Gus Schumacher Nutrition Incentive Program that you're interested in addition to the resources you have in the NIFA staff, while the funding opportunity, right, is open to ask the questions that you have, right, in addition to grants.gov and their help desk, their resources, there is also that technical assistance center that can provide, another level of support, right, of resources in navigating these applications.
Okay, thank you so much. All right, so the next question. So someone noted that funding in isolated communities, states, and territories are really limited. So how does NIFA address that?
Again, NIFA is really looking closely at this socially disadvantaged communities, if you will. And we're using that lens in terms of our next round of RFAs. How can we do that better? We've actually already been doing that to some degree. I oversee another program area, food safety outreach program, and have already been built in ways to incentivize reaching out to certain communities based on what, again, the funding allows, what the legislation supports. And so there are ways in some cases of doing that. We do have some examples, models, and we are seeing some success, but it's not going to happen in a day, these changes that we are making. It's just that we need to continue and have a very concerted effort, because we know that there is this need that is being lifted up.
Okay, thank you, Dr. Chipman. All right, and do we have time for one more question? We do? Okay, so let's see. Okay, and this is a Mallory question. So for GusNIP, so what is the thinking about the results of building an evidence base on incentives for FB? So is that grocers or suppliers that would build such promotion or price reductions into their ongoing marketing of selected healthy food?
Sure. If I understand the question, I think I want to first clarify what we mean in the context of the GusNIP program when we use the word incentive. We actually mean a fiduciary incentive, right? So providing an immediate financial discount or providing, once a purchase is completed, additional financial funding, right? So you spend $2, you get $4 to use to purchase fruits and vegetables. So that's the kind of way that incentive is defined specifically in that program. But also, getting to the core of your question about grocery stores as an example. One of the services provided by the GusNIP NTAE, right, that Technical Assistance and Evaluation Center, is building communities of practice around specific interests in nutrition incentive and produce prescription plans. And so there is one community of practice that specifically focuses on brick and mortar retailers like grocery stores, corner stores, convenience stores, and what kinds of best promotional and marketing practices there are around these types of nutrition incentive programs, as well as, I'm sure, interest from those communities in best practices on the whole.
Thank you, Dr. Koenigs. And I'm sorry, go ahead, Sheila.
No, finish up.
I was actually going to hand it back over to you just for the closing remarks. Thank you all for your questions.
Well, thank you guys for attending our first launch of this new nutrition security survey series. We will be in touch with the recording, the slides, and hopefully follow up with the variety of questions that came in. So please be on the lookout for our social media and websites to respond to the remaining questions, and also to the remaining information for continuing education credit from the Commission on Dietetics. We look forward and welcome feedback. So feel free to reach out to me if you have feedback on the webinar series or thoughts. We welcome them as we shape future editions. And really, as we said in the take home, we really do see each of you as a key part to prioritizing nutrition security. So please let us know how best to lift up your talents and efforts in this area, and hopefully NIFA can support that. So I greatly appreciate the support we had for Office of Communications, Faith Peppers and Giselle, for helping us launch this series, and our wonderful panelists, including our director, Dr. Castille, for helping us launch today. So thank you again for joining us, and feel free to reach out if you have any remaining questions.
Thank you all so much.
Thank you, everyone.